All right.
Are you ready?
We're ready.
Okay. So when you're looking at the tooth, the top portion of the tooth that you can see is called the crown. So be careful. If we point to this and say, what ID this part, that would be the crown of the tooth. But if we say, what is this made of, then that's enamel. That's that really hard white structure on the outside of the tooth is enamel. It's the hardest substance in the body. Now the bottom part of the tooth that's in the bone that you can't see is called the root, and the area between the two is called the neck. It's supposed to be covered by the gums or the gingiva. So gingivitis is inflammation of the gums. And in some people, this gets worn away. Either they're aggressive brushers, that's what they call it, or just old age, or they got that part forced away somehow. They bit into something the wrong way, and it pushed the gums to the side. Sometimes they have to go in surgically and actually replace this gum, kind of pull it up or replace it with other tissue. Now, the teeth are actually set into the bone. This is the bone of the tooth, and it could be the maxilla or it could be the mandible. We can't really tell. But the bone is held in place, or the tooth is held in place by two things. Cementum, which is like cement that holds the tooth in place. So in that case, we would have to ask, what is this, this structure that holds the bone, that holds the tooth in place? It'll have to kind of give you more information. Or these little lines that also hold the tooth in place are called periodontal ligaments. Now the bulk of the tooth is called dentin, and that's this area. It's a lot like bone. It's not exactly like bone, so it's not considered bone, but it's a lot like bone. Okay, and that's considered the bulk of the tooth because it's the biggest part. And then on the very center of the tooth is this open space. It's filled with a liquid called pulp. And this is called the pulp cavity, and this is where all the blood vessels and the nerves and the lymph vessels are. And they go down through this root canal, because this is the root of the tooth, and they join the other blood vessels and nerves and lymph down here. So what else do we have? The point is the apical surface. I think that's about it. This is considered the alveolar part of the bone because it's an open air hole. Just like the alveoli in the lungs are open air bags, this is an open air hole that the teeth happen to fit down into. And that's about it.
Sweet.